In today's news, we see COVID-19 active cases in the BVI rising to a whopping 91.
Simmonds Preschool closed as child tests positive for COVID-19.
Also, health officials in a final push to get residents vaccinated before that July 3rd deadline, and all BVI Health Services Authority patients and staff are now to be tested. New, and of course this is according to new public access changes. We are also live with the one and only Ms. Shaina Smith on the COI. All that and so much more on today's edition of 284 News.
The win.
What are the hell?
I'm freaking out.
Is about these people.
It's always a pleasure coming to you live and direct from the
What's poppin'? What's really good?
Davis has won it for the Lakers. The wait is over. CCT Fire is here. Experience ultra-fast downloads, seamless streaming, and even more reliable connectivity on an all-new fire-blazing super-fast CCT Fiber network. CCT Fire. Bring it home and upgrade today.
It is a fantastic Friday here in the beautiful British Virgin Islands, Friday, July 2nd, and we are so happy that you could be joining us out of 284 Media. My name is Javon Wilson.
And I'm Ron Grant. It is always a pleasure. We wish you a happy Friday to each and every one of you. Before we get into our newscast today, just touching on a few summary items that we think are important for you. Of course, the Social Security Board and National Health Insurance have announced the suspension of all customer-facing services until further notice due to the spike in COVID-19 cases across the territory of the Virgin Islands. Now, residents needing the services of both agencies or any of the two are asked to call the offices for more information. In addition to that, health authorities are advising anyone who was at the music recital for the homegrown studios at HLSCC on a Tuesday night who is not fully vaccinated, they say, to isolate and contact the health department for testing, as persons there have been tested positive for COVID-19. Jovan, we of course continue to look over at ELSA, watching closely the happenings of that and making sure that we wish our brothers and sisters across the region, particularly right now Barbados, the utmost of safety.
Absolutely, rising to a Category 1 just this morning. Thankfully, it has weakened, and of course it will continue across the U.S. Now, viewers, as we head straight into our newscast for today, in a matter of a short few days, the BVI has recorded an alarming increase in COVID-19 cases, bringing the current toll to 91. Now, this was confirmed by the Minister of Health and Social Development, Honorable Carvin Malone, acting on information provided by the Chief Medical Officer, Dr. Ronald Georges. Listening.
I bring greetings to everyone in the Virgin Islands, the region, and the world. Following my report on Tuesday, June 29, 2021, the Acting Chief Medical Officer, Dr. Ronald Georges, has reported that an additional 42 positive cases of the COVID-19 virus have been detected. This brings to 91 the total active COVID-19 cases in the Virgin Islands. The Chief Medical Officer has been directed to issue a comprehensive statement outlining the measures taken by government, statutory bodies, public and private institutions, private companies, and public and private individuals to lessen the negative effect of the virus.
Now, viewers, with just 2 days left for persons to secure their first dose of that COVID-19 vaccine, the health minister and his team is now in a final push to get residents on board. He also spoke to concerns about new variants. Listening.
As an update of the progress of the vaccine rollout, to date, 12,993 persons have received their first doses, while 9,254 have received their second doses. An analysis of these totals show that on Tortola, 10,810 first doses and 7,939 second doses have been administered to date. On Virgin Gorda, 1,953 first doses and 1,199 second doses were administered. On Jocelyn Dyke, 98 first doses and 50 second doses were administered, and on Anegada, 132 first doses and 66 second doses were administered to date. Again, I want to make it clear that all vaccines in stock at the BVI Health Services Authority and at private medical healthcare facilities are expiring on July 31st. I am again appealing to everyone who has not received their first dose to do so by July 3rd to ensure that they receive the second dose within a 4-week time frame and are fully vaccinated as per the vaccine manufacturer's guidelines. If you are not going to do it for you, then do it for your parents, your grandparents, your great aunts and uncles. They are our most vulnerable who are impacted by this disease. If you are not going to do it for you, then do it for your children. At the end of the day, we are hoping that the protection of the adult population will in turn protect each child under age of 17 in this territory. If you're not going to do it for you, then do it for your employers. Every person vaccinated in a workplace continues to protect other employees and ensure that work continues, services continues to be rendered, and you can get paid.
Viewers, that was the Honorable Minister of Health, Honorable Carvin Malone, of course, really speaking to the situation on the ground. In addition to that, our newsroom is now in receipt of a letter that is being circulated by the BVI Health Services Authority that actually now mandates that new recruits, any prospective employee of the BVI Health Services Authority, they must take the COVID-19 vaccine. And of course, more information on that will be provided. But Ron, I think really speaking to the situation on the ground as we continue to see cases rise in the territory.
And continuing on, viewers, the BVI Health Services Authority is taking a two-pronged approach to the current uptake in COVID-19 cases. Since the onset of the pandemic in March of 2020, the British Virgin Islands Health Services Authority has implemented multiple protocols to address the various pandemic-related scenarios. Now, in consideration of the current strides to return the territory to some normalcy and multiply cases recently discovered, the Incident Command team of the BVI Health Services Authority met on July 1st, 2021 and decided to upgrade the organization's safeguarding strategy. It was decided that the first of the two-prong approach will be focused on internal protection. Now, in this regard, management has decided that all BVI Health Services Authority staff and patients will be tested to ensure their well-being. Now, these tests will be carried out by the Employee Health Unit. In the event an employee tests positive for COVID-19, BVI Health Services Authority says even if they have no symptoms, their supervisor will be notified and employees will be asked to stay home and follow the Ministry of Health's COVID-19 protocols. Affected employees will also be provided with guidelines on when to report back to work. Now, of course, in tandem with the test, the BVI Health Services Authority will implement various safeguarding and social distancing protocols to minimize COVID-19 exposure within the organization. Now, the second prong approach is external in nature and will see the organization monitoring and implementing, among other things, new changes to its visitation policy. Now, this second prong is in keeping with the BVI Health Services Authority's commitment and patient safety. Now, Acting Chief Executive Officer Mrs. Cordine Malone-Smith explained that this two-pronged safeguarding initiative will be monitored over the coming weeks. The head of the BVI Health Services Authority also examined that this approach was necessary at this time. She said, and I quote, "We are committed to the health and wellness of our patients, hardworking and dedicated workforce, as well as the community we serve, and we are taking the necessary precautions in this bold, proactive step to ensure their protection and safety." Mrs. Malone added, and I quote, "We will ensure every single employee is tested so they can now know their status and take the necessary precautions to continue to stay safe." Now, this new visitation policy has altered the hours of public access. As such, visitation has been reduced to 10 a.m. until 2 p.m. and only one visitor is allowed at a time for a maximum of 30 minutes. However, please note that special considerations will be given to the intensive care unit, pediatrics, and patients with special circumstances. It was decided that elective surgeries in schedule will be with special guidelines, and outpatient clinics be opened from 8:30 a.m. to 3 p.m. for priority and high-risk cases that are by appointment only. Now, the pharmacy viewers will be open for drop-off and pickups from 8:30 a.m. to 3 p.m. As such, persons are encouraged to WhatsApp their prescriptions at 440-1726 or call in prescriptions at 852-7556. Outpatient imaging and laboratory services, they are also available to the public from 8:30 a.m. to 3 p.m. Jovan, we see that the Health Services Authority continues to try their best to be proactive in making sure that not only our community members are safe, but the persons working at the health facilities are also safe, which I think is of paramount importance.
Absolutely. We also saw earlier today concierge services for persons
Yes.
or companies who want to have their staff vaccinated. The team was actually going about and around to various businesses to ensure that persons who want to take the vaccine can do so by the deadline.
Viewers, still ahead, Simmonds Preschool is closed. It's a child test positive for COVID-19, and we are joined by Shaina Archer. She is the host of Vigilate Dialogues. We're talking all about the COI and recapping the week before us.
Is business slow? Cash flow down? Hosting an upcoming event? We can help. Advertise with 284 Media and take your business or event to the next level by enhancing your present marketing and messaging strategies. Allow our team of experts to create a personalized ad that sets your business apart from all the rest. This could be your business or event. So, what are you waiting for? Contact our marketing team at 284media at cctbvi.com. Advertising with us works.
Viewers, welcome back.
All right, viewers, on we go to the next story. Now, the Ministry of Health and Social Development is now notifying the community that Simmonds Preschool will be closed temporarily for 14 days following the detection of suspected and confirmed COVID-19 positive cases in the pediatric population. Now, Dr. Ronald Georges, the acting chief medical officer, said, and I quote, "A full assessment was conducted on the 29th of June, after which we quarantined the primary contacts. On July 1st, we returned after reports of symptomatic children and another confirmed case. Now, based on the assessment, we erred on the side of caution and closed the school to reduce transmission and facilitate decontamination." We also spoke to parents today regarding the situation and provided information on best practices moving forward. End of quote. That was Dr. Ronald Georges, viewers. Now, both parents and children will now be required to self-isolate for 10 to 14 days with daily monitoring being carried out by a public health officer. Testing will be scheduled within 14 days. However, persons developing symptoms such as a headache, runny nose, nasal congestion, fever, dry cough, muscle aches, vomiting, loss of taste, smell, or appetite should immediately contact the public health unit at the number 468-4936 or 468-2274. You can also call 468-2285 or the medical hotline at 852-7650 for guidance. Dr. Georges continued, and I quote, "I want to reiterate to the community the importance of following the established protocols and guidelines. Reducing your risk of contracting COVID-19 is as simple as washing your hands and or sanitizing for 20 seconds, wearing masks properly, physically distancing, that is 3 feet at least, and covering coughs and sneezes regardless of your vaccination status." The Ministry of Health and Social Development is, of course, committed to improving the health of the people of the Virgin Islands. Ron, quite a scare, but I'm really happy that we were able to catch on to this really fast, and the active contact tracing has begun.
Yes.
And of course, the school is closed to facilitate slowing that curve.
And of course, we wish all persons affected the safe and speedy recovery. Viewers, we now pan across to the COI. Of course, this has been an ongoing conversation for the past weeks. We are today joined by Ms. Shaina Archer, the host of Vigilate Dialogues. Mrs. Archer, welcome to 284 News. Thank you so much for your time.
Good afternoon. Thank you for having me.
Ms. Archer, we have continued to watch. Of course, let's take this past week into consideration. Former legislators, senior civil servants, and of course, our very own legislators who are sitting at the moment continue to be witnesses to the COI and answer a number of questions. We see quite a bit being unfolded. I must begin by saying that I think this has been a learning experience. I hope it has been a learning experience for many residents as they continue to watch on. But from your perspective, let us begin by just putting into perspective the process of the COI thus far.
Okay. Well, it's something, you're right, it has captured, the entire community's attention. And we have a lot of commentary that has been going on about it. But I think it's important for us to, in a nutshell, understand this is just sort of like the beginning phase of this as it relates to, investigating or gathering of information that at the end of it, a report is going to be done. And then from there, there will be recommendations in terms of if any actions need to be taken, in terms of correcting systems or anything outside of that needs to be further investigated. Those are things that are going to come forward. So, I also want to caution everybody to pace themselves because, this is going to probably take us straight through to the rest of the year.
Yes, indeed. There are many persons, Mrs. Archer, under the misunderstanding that for some reason the COI has the authority to lock persons up as it pertains to any corruption found. Now, correct me if I'm wrong, but the COI does not have that authority. What they do, like you just mentioned, is to make considerations and observations. And if, in fact, there is some level, something that needs to be investigated, then that is a case then for the legal teams, the officials of the Royal Virgin Islands Police Force, and they then have to begin their own investigations. Am I correct?
Yeah, basically.
Okay.
Because it's and we've heard the commission actually say several times, in terms of questions that have been asked about the purpose and the processes of the commission, and it is that, you're gathering information, there is a report, and of course, I think it was mandated to be due by this month, actually, July. So, again, we're going to see them start to wrap up the hearings, and if there's anything else that will be added to that, and then see what brings at the end of the month.
Now, you have been for a long time a member of the civil service. You've began your career within the civil service as an employee, a former employee, of the government of the Virgin Islands. What are some outcomes? I want to talk about outcomes because at the end of the day, we're going through the COI, but I don't think it is fair for us to go through this and not learn something. What are some of the outcomes that we can take away from this as residents?
Well, I think what's one key thing for me, I think, is the importance of what we call the level of participation that we as a community do. Oftentimes we think of just going to the poll as a way to correct things. But one of the things I think that people are learning a lot about is how the systems of the public service work and understanding what we mean by checks and balances. So the Auditor General, was one of the persons that spoke this week. And I think she shed a lot of light and opened up eyes in terms of, what her job is. And sometimes she's seen as the bad guy. But for me, once you're doing the right things, following the rules, then, you don't have any issues with them. Because again, their job is to make sure that we're all doing what it is we're supposed to do. So I would like to see that, we take into consideration those systems that need to be changed. I mean, everything from how the House of Assembly is structured has been discussed. In terms of changes, and all of these are things that would fit right into the conversation around constitutional review, because if that is basically where it is laid out, how our parliament system is set up. So, I want persons to also take note of that. I know there's a lot of other emotionalism as it is around this whole thing, and other social issues that are tagged on, I would say, to it. But we need to also be objective in our thinking as it relates to when recommendations do come, that we take it to heart as us as a community. What are those things that we need to continue to be vigilant about, so to speak? Because we do hear a lot about things with, whether it's contracts or projects or all these things that are being discussed, but nothing comes of it, So it's important that when we do have breach of rules, that people are held to account. That doesn't necessarily mean people have to lose their jobs. But it is something where sometimes it's about orientation, making sure that people are constantly reminded of this is the way that we're supposed to do things, and not try to make excuses. I think that was one of the sad parts for me when, sometimes we try to justify, what's going on and think that, we'll learn from it just like that. But if we don't think differently about, this is a situation definitely we feel embarrassed on a national level. This isn't something you want to be out there on the international stage as part of your community. But, how are we going to now learn from this and correct the problems that are our responsibility? If we feel that the Foreign and Commonwealth Office, they have responsibilities that need to be addressed, let's address those as well. But let it not just be about pointing fingers or blaming anybody, but that we first and foremost own the problem, and then from there we can put plans in place to correct it.
And then clearly understand how do we respond, where do we go from here. One of the things that I think is perhaps the perfect storm we can learn from is not to be ashamed of our system. There are people who have failed us, there are legislators who have failed us, and we've taken it, just like you said, for granted. I think ignoring it and turning a blind eye is not the answer, because at the end of the day, we do have areas that we need to improve upon. And I think once we own that and accept that, perhaps that's like we're always told, acceptance is the first step.
Yes, definitely.
All right, I want to take good governance, for example. That's been a huge topic of discussion. How well are we doing, would you say, as it pertains to that in particular aspect?
Well, you know, this is something I spoke about on my show last year. And when we talk about good governance, I know that was one of the questions that the commission put to our legislators. And I read some of the position papers, and, you know, it was interesting to see the interpretation of what it is and what it isn't. But again, from an objective view, you know, there are certain characteristics, things like accountability and transparency that we hear all the time. But I don't think we have a good understanding of what that means. Transparency is about, you know, what kind of access to information does your society have? But they're also more important, I think, in terms of characteristics like rule of law, participation. So when, you know, people hear me speak a lot about stakeholder consultation, that is part of good governance. Absolutely. And those are things that have been missing. I think at some point we were more active as a civil society. And I think we became either too trusting or too busy, as it were, that we left things to the politicians to do and figure, you know, the public service is going to run the country in all our best interests. And, you know, of course, we always want to give everyone the benefit of the doubt. But anytime, you know, something is not happening, we need to start to, you know, perk up and pay attention and say, you know, what's going on here? You know, how do I start to engage with the process? So when we have situations like or I should say scenarios like the National Development Plan, that's out, that we should engage fully in processes like those in terms of saying, you know, these are the things I want to see when it comes to our education system. These are the things I want for healthcare. Things like unemployment benefits, you know, we shouldn't take it for granted. And I don't like when we're very reactionary, because Ron, is always when we get in trouble.
Of course.
You know, it's when we start to realize again, we need to address this. But sometimes these are things that we have known for so long and continue to kick the can down the road. So I want us to be more proactive. I think being proactive in our thinking is also part of good governance that we also need to address. And be more assertive when it comes to the development of our country.
I could not agree with you more, Mrs. Archer. We thank you so much for your time and coming to shed light. We definitely plan to have you back to shed some more light and continue the conversation, because like you said, we're just kind of getting into the heat of the COI, and it's going to be a much longer road ahead. So we continue to look forward to that conversation. Thank you so much for your time.
Definitely. Thank you.
Viewers, we'll be right back after a word from our sponsors. You're watching 284 News.
So you're saying I can ask this cat any question?
The cat is connected to the computer. You just type in the question, it will read his mind. There the answer comes.
You're the man! I've been looking for this for weeks.
Father Jesus, that line here long like church service.
Alright, you enjoy the rest of the day. Next customer line, please. Wait, hold on a second.
Yes, Sonny boy, come, yes, Sonny.
Good morning.
Good morning, Sonny boy. Over there. You must have cut fun topic.
It's okay, I'll take care of it.
What? No man to take care of me.
How may I assist you? You want top of power?
You want top of power?
Join the prepaid party with CCT and enjoy more affordable data plans. More top-up promotions, more savings with hero bundles, and more value for your money each and every Tuesday with Top Up Turn Up Tuesday. Visit a CCT store today or anywhere CCT Top Up is sold and top up your phone.
5, 10, 15, 20, 25, 30. You want top up or?
Viewers, welcome back to 284 News. Now, the world over is about to witness history on July 11th. Richard Branson and his team is about to fly off into space, and trust me, you want to hear all about it. Let's go to a quick clip.
Chief Pilot Dave Mackay, I'll be flying VSS Unity into space on the Unity 22 mission, joined by a full crew of Virgin Galactic mission specialists.
Pilot Mike Masucci, I'll be in the cockpit for my second spaceflight.
Astronaut 004, Sarisha Bandla. I'll be testing the researcher experience.
Astronaut 003, Colin Bennett. I'll be evaluating cabin procedures during boost and weightlessness.
Astronaut 002, Beth Moses. I'll be spaceship cabin lead and test director.
Astronaut 001, Richard Branson. I'll be evaluating the customer spaceflight experience. As the Virgin Galactic founder, I am so proud to have this remarkable crew of mission specialists and pilots by my side as we fly to space. I've always been a dreamer. My mum taught me to never give up and to reach for the stars. This July, our dream will become a reality. And we're really excited to share that moment with you all. And when we return, I will announce something very exciting to give more people the chance to become astronauts. Because space does belong to us all. So watch this space.
Now, viewers, the Unit 22 team will consist of 2 pilots, 4 mission specialists, and of course, Mr. Richard Branson himself, a true visionary, of course, and the world gets to preview this life-changing experience. You're encouraged to tune in on July 11th for that. Now, as we move on, the Minister for Natural Resources, Labor and Immigration, Honorable Vincent Whitley, has announced that beaches will remain open to the BVI public despite requests from a cruise company to have it open only to their passengers, and also a flyer circulating from the National Parks Trust that suggests otherwise. Now, the flyer posted to the National Parks Trust page stated, and I quote, "On days when cruise ships are in port, the Greater Bads National Park will be closed to residents and other non-cruise ship guests between the hours of 9 a.m. and 2 p.m. The park will remain open once the necessary cleaning and sanitization procedures have been undertaken," end of quote. Now, viewers, Minister Whitley has since responded, strongly dismissing those claims. He said, and I quote, "Despite many requests by cruise lines to have beaches open only to them, the government of the Virgin Islands has never and will never agree to this, as all beaches are public. This decision has been made a long time ago, and all government members were made aware of it." Now, the minister expressed disappointment in the flyer that is being circulated to indicate otherwise by the National Parks Trust. He said, and I quote, "I find it quite unfortunate that a flyer should come out saying differently. Despite all efforts to have it corrected in a timely manner, the debacle was allowed to escalate, no doubt causing great harm to our reputation. The matter has since been rectified by the relevant department. In such difficult and uncertain times, we all have to work together for the betterment of the BVI." He continued, "As a government, we will continue to make decisions that will keep a balance between protecting lives and livelihoods." Now, viewers, as you can imagine, many residents are perplexed as to why the messaging sent out by the overseeing minister and the National Parks Trust is not cohesive. One resident said, and I quote, "This is a serious need for more synergy and communication," and I think a sentiment echoed across the territory as we continue to see this jointed messages being sent out by various departments regarding very important matters in the territory.
I agree. At the end of the day, the government seems to be on the same team, but then they still seem not to be on the same team, and I think that's where we need to do some work. Viewers, we have had a jam-packed newscast, and we thank you so much for sticking with us. Do have an enjoyable weekend. And of course, it's a long weekend, but do try your best to be safe and enjoy yourselves. I'm Ron Grant.
And my name is Javon Wilson. Happy long weekend.
Bye-bye.
Bye-bye.